Good afternoon, everyone. This is Dr. Val Arkush. Welcome to our weekly briefing on COVID-19 here in Montgomery County. Today is Wednesday, July the 22nd, 2020. We are in week 20 here in Montgomery County of the COVID pandemic, and we are in week 4 of the green phase. Since our July 21st press release, we have 59 new cases of COVID-19 reported in Montgomery County, which brings us to a total of 9,150. These positive cases are a result of a positive test for the virus, not from an antibody test. 2 of the 59 cases are from long-term care facilities. 3 are from the Montgomery County Correctional Facility, and I'll talk a little bit more about that later. And 54 are from our community. I do think it's important to note, and many of you are aware, that we have had a serious lag in getting test results, and this has been across the county, not just with the county tests. So of these 54 from our community that we're reporting today, 24 of these tests were conducted between June the 7th and July 11th, and 20 of them were conducted during the week of July the 12th to July the 18th. And later on, I will be showing you graphs of our positivity rates based on the date that the test was conducted. So that helps correct for this lag time in getting tests back. These positive individuals are from 25 municipalities. 61 of 62 of our Montgomery County municipalities are home to individuals with COVID-19. These individuals range in age from 1-year-old to 91 years old. And as always, you can take a look at our county map found at www.montcopa.org/COVID-19 for updated geographic information. Today we have 31 females, 27 males, and 1 unknown. I am pleased to report today that we have no Montgomery County deaths to report. So that leaves us at 817 deaths confirmed positive from COVID-19. Overall, 437 females and 380 males have lost their lives to COVID-19. In terms of hospital beds, today we have approximately 56 individuals hospitalized with COVID-19, with 12 of those individuals requiring a ventilator, or approximately 21%. So this number has been fairly stable over the last week or so, around 55 individuals hospitalized in our Montgomery County hospitals. Now, in the Montgomery County Correctional Facility, since June the 25th, the correctional facility has had 8 individuals booked into the correctional facility that have tested positive for COVID-19. These individuals contracted the coronavirus prior to entering the correctional facility. All are in isolation and currently stable. And I just want to reassure anyone who has concerns about the correctional facility that there is a strict protocol for all new commits, and that involves keeping them separated from the general population within the correctional facility and testing them at the time that they are committed, so that no one is allowed access to the general population until we have some certainty about their coronavirus status. And at a minimum, all new commits are held in a separate area for 14 days. So in terms of our community testing, as you know, the county now has 6 COVID-19 testing sites open around the county. None of these sites require a car to be tested. These sites do require an appointment. All appointments are made on the day of the test, beginning at 8:30 in the morning. You cannot book ahead. We do require that the person being tested is either a resident of Montgomery County or works in Montgomery County. These county-run sites provide testing at no cost, though insurance will be billed if you have it. We do not require a healthcare provider's order, and we will test individuals of any age who either need or want to be tested. The cost of these sites is being covered by CARES Act funding that has been allocated directly to Montgomery County. As a reminder, the sites are located in Pottstown at the Montgomery County Office of Public Health, 364 King Street in Pottstown, Lansdale at 421 Main Street, the Willow Grove Office of Public Health at 102 York Road, in Green Lane at Deep Creek and Snyder Road, in Ardmore at 114 West Lancaster Avenue, and in Norristown at 1401 DeKalb Street at the Delaware Valley Community Health Center. Each of these sites has some daytime hours and then some later afternoon hours. And there's been a little bit of change with the Norristown hours, so I'm going to just read those to you. The Norristown site is now open Monday, Wednesday, Friday from 10 to noon, and Tuesday, Thursday from 3 to 5. And we just want to really thank our partners at the Delaware Valley Community Health Center, Dr. Scott McNeil and Dr. Julia DeJoseph. They have been such wonderful partners in this work on testing. To register for a test, you can register online for any of the 6 sites at macopa.org/COVID-19 under the green County Testing Information button. And again, appointments open at 8:30 a.m. on the day of testing. Now, because we allow only same-day appointments, you will see on the appointment website that it may say that a particular site is closed for testing tomorrow. Please ignore that. That has to do with the appointment algorithm. It requires that it says that. And appointments at that site will open at 8:30 a.m. Monday through Friday. The only change would be if there was severe weather. We had to close a couple sites the other day because of severe heat. But in general, all sites, the appointments will open for testing that day at 8:30 in the morning. Also, you can register by phone at any of the 6 sites. There's one phone number. That number is 610-970-2937. That also starts at 8:30 in the morning on the day that you would like to be tested. There are both Spanish-speaking operators and language line translators available by phone. Now, as I know many of you are aware, there's been significant delays in receiving our test results back. It has been taking for some people more than 10 days to get their test results back. This is a serious and extremely frustrating situation that is occurring across multiple lab companies. I've had 2 calls now with Quest Diagnostics, who is running tests for the county. They attribute the delay to their labs being over capacity given the explosion of new cases around the United States. They are working to expand capacity, but at this point that means purchasing and installing additional equipment to run the tests, and that takes time. This slow turnaround time is unacceptable, and while the county is continuing to work with Quest for now, we are exploring as quickly as possible other reliable labs. And this just serves as another reminder of how we really are all in this together and how actions of individuals in other parts of the country are negatively impacting us here in Montgomery County. So we just had to keep at doing what we're doing. As we've discussed before, together through a lot of shared sacrifice over these last 20 weeks, we have dramatically reduced the viral spread here in Montgomery County. But this is absolutely no time to let up. Keeping the spread of virus low will enable our businesses to stay open and our children to go back to school this fall. And it will keep our hospitals and our first responders safe. So let's see how we are doing. We will show you here our regular graphs that we show you each week. So this first graph shows you the daily positive cases. So this is the gray vertical bars show you the total number of positive tests on that particular day. And then the red lines show you a 7-day average, which is the dark red line. And then the pinker line, the 14-day average of positive cases. And this graph is by the date of the test, not by when we got the test result back. So this does help you see much more accurately how we're actually doing. Our community 7-day average and 14-day average are in the blue lines, and then our long facilities are in the orange and yellow. So some more information about this. So as of, and this graph, by the way, goes through July the 17th. That's when we felt we had complete enough data. Our 7-day average is 26.7 cases. Our 14-day average is 31.4 cases. And these are both up slightly by a couple of cases than they were a week ago. So we've been seeing a little bit of up and down in our numbers in the last few weeks, but nothing too substantial. We're holding pretty steady. I also want to point out our long-term care facility numbers. So on April the 21st, we had our peak positivity and incidence of long-term care facility cases, or at least in terms of those averages. Our 14-day average on April the 21st was 64 cases a day, and our 7-day average on April the 21st was 70 cases a day. And I'm now happy to tell you that we are averaging less than one long-term care facility case each day. So I just want to thank all of the folks on our FAST teams who made more than 80 visits to long-term care facilities to provide support and guidance and PPE and training, and all the staff at the long-term care facilities who really worked hard to get this right and have made just fantastic progress. This is a very, very complicated situation for all of our long-term care facilities, and all of the staff and residents really stepped up. And I'm so happy to see that our numbers are down to less than one case a day on average coming from our long-term care facilities. Now, the bigger picture graph is our overall positivity graph for cases in the county. And so what this graph shows you is the orange line is the total number of PCR, which is the test for the virus, cases done here in the county between March the 13th and July the 17th. So that orange line is very jaggedy because it accounts for weekends and just different numbers of tests being conducted every day. And this is not just the county tests, this is like that we run, but it's any test done on a Montgomery County resident, regardless of where it was done. And then the blue line is what percent of those tests were positive. And so I'm happy to tell you that we continue to run, as of July 17th, 3.54%. That's 3.54%. That is compared to the graph we showed you last week on July the 10th, when we were at 3.3%. So again, we're seeing a little tiny bit of ebb and flow there, but nothing dramatic. And this is a good place to be. Having our positivity rate less than 5% indicates that we have a pretty good control on this virus and that we are keeping it suppressed. It's not going to go away. We're not going to get to zero, I don't think, until we have a vaccine in our midst. But at this low level, it makes it much, much safer for our businesses to continue to stay open, and hopefully for our children to be able to go back to school this fall. So what can you do to help make sure that we keep our positivity right where it's at now, under 5%? So there are 5 things that you can do. Number 1, do not leave home without a mask under any circumstances. I don't care where you're going, even if it's for a walk around the block. please do not leave home without a mask or some kind of facial covering. And put it on. Have it with you so you can put it on whenever you are within 6 feet of someone who is not in your household. Number 2, keep 6 feet of distance from anyone not in your household. Number 3, keep your hands clean and away from your face. Number 4, get tested if you need to or are advised to. And number 5, cooperate with contact tracing. I cannot stress enough how important it is to cooperate with our contact tracers. These conversations are confidential and they're non-judgmental. Some individuals who've been to parties or other gatherings during their infectious period have been unwilling to share with our contact tracers who else was at a particular event. And what they do is they tell our contact tracers that they will let people know that they might have been exposed. That, in other words, they will sort of take on that burden of letting people know. And we appreciate that, but it's not adequate for the following reasons. And I want to explain in more detail what our contact tracers are doing so people will understand why it's so critically important that they give us as much information as they can. So first of all, our contact tracers officially inform an individual of their requirement to quarantine due to exposure to COVID-19. Our contact tracers are able to answer any questions that the individual has about COVID-19, what symptoms they should look for, whether or not they should get tested, things like that. And if the contact tracer can't answer the question, they can refer them for additional guidance. Very importantly, the contact tracers will ask if the individual is able to safely quarantine in their home. There are many reasons why someone may not be able to do that. They might have someone in their home with a very serious medical problem that if they contracted the coronavirus, they would be at high risk for a serious case. Or maybe they don't have a separate room in their house that they can retreat to in order to quarantine. So if a person cannot safely quarantine in their home, then the contact tracers will offer them no-cost alternatives so that we can get them safely housed during their period of quarantine. Also, additional supports can be arranged, such as help with food delivery or other unmet needs, because we understand that you could get a call out of the blue that you need to quarantine, and you may not have enough food in your refrigerator to get you through 2 weeks. So we're here to help with that, and we will make sure that you do. So these are some of the reasons why we need to have our contact tracers make these calls, not just a friend of a friend, trying to be, a good citizen. So the more that people can cooperate, the better. It is absolutely critical to the suppression of the coronavirus in our region that we get 100% cooperation with contact tracing. Now, we've been asked about what caller ID would look like if a contact tracer is calling. And I just want to remind everyone that the county is contracting with 4 of our trusted partners in the community to do this work. And so 2 of those organizations are ACLAMO, which is spelled ACLAMO, and VNA, or Visiting Nurses Association. Both of those organizations consistently have that name show up in your caller ID. 2 other organizations that we work with are Family Services of Montgomery County and Montgomery OIC. In the case with both of those organizations, and they are trying to get this fixed, you might see their name, but you might also see the word unknown. And then finally, the County Office of Public Health, unfortunately, also comes up as unknown. And this relates to the type of phone system that we use in the county. And we are told that we are not able to change this. So I'm sharing all of this very detailed information with you to let you know that if you know you've been tested, or you believe or know that you may have been around someone who's tested positive, and you see unknown come up in your phone, we would be grateful if you would answer the phone and work with the individuals who will identify themselves as contact tracers. Okay, so moving on to a couple of announcements. I just want to remind everyone to complete the 2020 census if you haven't already. As of yesterday, Montgomery County's self-response rate is 73.4%. Not bad, but we really need to get to 100%. The financial implications for the county are enormous. So thank you to the 73.4% of you that have responded, and we really hope that the rest of you will step up and do your part. The higher our participation rate, the more funding we will get from many different critical services. And today I'm highlighting emergency response services because they've been so crucial in responding to this pandemic. Census statistics are important to help plan where to build new hospitals and clinics, or whether or not existing ones should be expanded. It also helps EMS services figure out where they need to expand and offer more services. Many fire departments use the census numbers to identify growing neighborhoods to ensure that they have enough resources to respond to a fire emergency. Census data is also critical for determining evacuation routes and supply distribution for both national disasters and public health emergencies like COVID-19. If you haven't filled out your census, please do it today. And if you lost your form or never received one in the mail, you can respond by going online to my2020census.gov. So my2020census.gov. Or you can call 844-330-22. Oh, looks like I'm missing a digit here. So I'm not sure what that full phone number is, but if you do go to that website, my2020census.gov, I know there's a phone number on there. If you do choose to call, there are over a dozen different language lines available if you would be more comfortable responding to the census in a language other than English. And you can also find individual phone numbers for different languages at that my2020census.gov website. Okay, so please get that done. Also, and we've been reminding you about this throughout, but I want to do it one more time. Just remind you about general preventive health care. Please make sure to maintain your regular preventive health care screenings and immunizations. I realized about a week ago that I had been due for a mammogram back in May. Obviously, that didn't happen, but I called yesterday and made an appointment. It's so easy during this time to lose track of these things. So maybe just take a few minutes and think about yourself, think about your family members, and make sure that you're not due to get your teeth cleaned or get that mammogram or other preventive health screenings. Our medical community is back at work and able to provide these services. I also want to make sure that you check on your children's immunizations, make sure that they are up to date. Whether you're planning to send your child back to school in person or remotely or some combination of the two, so important that their immunizations be up to date, this year especially. And then finally, I just want to remind everyone that the flu vaccine should be starting to arrive within the next several weeks. And it often shows up at drugstores first. You'll see those signs go up that say flu vaccine available here. It's always important to get the flu vaccine, but this year it is extremely important. And this is both for adults and children. And the reason is that symptoms of the flu are very similar to symptoms of COVID-19, and both can result in the need for hospitalization and assistance breathing with a ventilator if you get a severe case. By getting a flu vaccine, you greatly reduce your risk of becoming critically ill from the flu and needing hospitalization. So there's a lot of concern about this fall and winter in particular, when people really don't have much choice but be back indoors, what that might do to the spread of the coronavirus, and in turn, what that might mean for our hospitals. So the more people that get their flu vaccine, the fewer people that will need to be hospitalized for the flu. So I just can't overestimate how important this is. So please start to look for those signs and get your flu vaccine. Thanks to the Affordable Care Act, all health insurance companies are required to cover flu vaccines at no cost to you. And I did just get a quick message of phone number for the census. If you would prefer to complete your census, you can call 844-330-2020. So 844-330-2020. All right. So with that, I will just announce that our next virtual briefing will be next Wednesday, July the 29th at 3 p.m. And I would be happy to take questions.
Thanks, Commissioner. This afternoon, we're joined by Todd Shepard from the Delaware Valley Journal and Jim Melward from KYW 1060. We will start our questions today with Mr. Shepard.
Thank you, everyone. Commissioners, Governor Wolf has now admitted that he withheld some funding from Lebanon County because the county defied some of his earlier orders. Given that the actions that the governor took deal with the exact same office you're in, are these actions from the governor okay with you?
I really can't speak to that. I don't have any idea of the circumstances in Lebanon County and any of the specifics or why the governor took that action. So I'm not prepared to answer a question like that.
Any additional questions, Todd?
No, thanks.
Okay. Thank you. We'll move on to Jim Melward.
I have a bunch of questions about testing, and I guess to kind of start off with, where are most tests being done now? Are they being done through health systems, through hospitals, through the county sites? Do you have an idea of where most of those are being done in Montgomery County?
Well, so there's sort of two questions in that. So in terms of the tests being actually collected, right, the sample being collected, that is happening all over. It's, our county sites are doing about 152 or so tests per day right now, and we're working to increase that. CVS and Rite Aid are doing some number of tests, and there's other urgent care locations, patient first, places like that. And by the way, you can find a lot of those on our county website. And then our hospital systems are also doing testing. For the most part, you do need to be a patient of one of their physicians or nurse practitioners that are in that health system in order to get tested in those locations. So that's sort of the first step, is to actually get the sample collected. And then there is the lab that actually runs the test. So in the county's case, we are sending our samples to Quest. I believe that CVS and Rite Aid are using either Quest or LabCorp. I'm not sure which one. Our hospital systems, for the most part, have some capacity to run tests within their facility, but I believe that they are also sending some tests out, but I'm not 100% sure of that. So it's a mixture, and I don't have exact numbers for you.
Okay, yeah, you got it. The question that I was, the sample collection was what I was asking. And do you know what other, like CVS, Rite Aid, or urgent cares, do you know, are their results also taking upwards of a week? Do you know that?
At least. I'm certainly hearing and getting messages from constituents that they're waiting, 10, 12, 14 days in some cases.
So then it's fair to say that the majority of tests results are taking about a week.
So I'm reluctant to use the word majority. I don't actually know how many tests the hospital systems are doing on a daily basis, and I don't know with any degree of certainty how long their tests are taking to come back. So I wouldn't want to characterize it it's the majority, but there's certainly a significant number that are taking about a week to come back.
Okay. With that in mind, as we look at reopening schools, how can we do that, or does that delay kind of weigh into the safety of opening schools or the decisions of having in-student instruction?
Yeah. So I don't think that delay is relevant for the actual opening of the schools per se. What is much more relevant to the decision whether or not to actually open a school is the positivity rate that we're seeing in our community. So organizations, research organizations like the Harvard Global Health Institute have done modeling around some of these questions. And by and large, most of the modeling, and this is from different organizations, suggests that if you consistently have a positivity rate that is under 5%, then the virus is under fairly good control and it is relatively safe for businesses to be open and for schools to be open. And I use that word relatively because I just want to remind everybody that there is no school or place of business or any place that can guarantee you that there will not be coronavirus within their building or their place of business. And as I've talked about with school superintendents and school boards and others, that the decision for each family to send their particular child back to school or not, in person or not, really has to be an individual decision of that family and will depend and be important upon their personal circumstances. So for instance, do they have someone in their home who is at very high risk should they contract the coronavirus? Or on the flip side, is it a situation where a parent really has to get back to work and it's quite important that that child go back to school in person? So there's many individual circumstances that families are going to have to sort through. But it's that positivity rate that relates to the opening. Now, where this test lag is going to be important is when we think about if a child or a teacher or staff member is displaying symptoms and gets tested, well, then obviously we want that test to come back as quickly as possible so that we can do the contact tracing and we can know if there were any students or teachers or faculty, or staff that are at risk of direct exposure that need to also then go out into quarantine. And that test lag is definitely problematic in terms of that aspect of this. And that is why we are working so hard to identify a different lab that would be able to get us our results back in a much, much quicker fashion, because it would be very difficult to do adequate contact tracing if it is taking a week to get our test results back.
And you mentioned a possibility of other labs. Is there anything that you can say about that now?
Not today. I'll let you know as soon as we have something definitive.
Antigen tests. I know you guys talked about, I believe, the Abbott test early on. We haven't heard much about that. The one comparison I've heard recently is at-home pregnancy tests, where it's not perfect, but it's a good kind of indicator, and then you can go get a better test if need be. Is this not using those or staying away from those? Is that an example of perfect being an enemy of the good, or are they just not at a point where they're reliable at this point?
So there's a number of different companies that are making these antigen tests, and they have varying degrees of what's called sensitivity, which means that they are likely to detect the virus if you actually have the virus. So they look for fragments of the virus in the sample, whereas the PCR test that we rely on goes through a much more complicated process and is much more reliable in actually being able to find the coronavirus in the sample. So because of the different way that these testing techniques work, the antigen tests are about 62% sensitive, maybe 65% sensitive, meaning that they would, if you took 100 people, it would correctly identify that 62 of them actually had the virus. So take 100 people that were positive. 65% maybe it would get that they were positive. Now, having said that, some of these antigen tests appear to be a little bit better than that, but that's sort of the average. Whereas the PCR tests that we're doing at all of our county testing sites is 90 to 95% sensitive. So if you had 100 people that were positive, it would pick up 90 to 95 of them. So that's a pretty big difference. Pregnancy tests, by the way, are way more sensitive than 65%. They're pretty accurate. So the hope is that these tests will continue to be refined and that soon, because boy, could we use this, we could certainly use this today. Soon we will have these rapid tests that are more sensitive and could be put into widespread use. But really we need antigen tests that are consistently more in the 80%, low 80% sensitivity to be used as the type of screening test that you're describing, so that we know that we'd be picking up the vast majority of the people that were actually positive.
Would frequency of those tests help the accuracy? If you were doing them often, does that help, or is that, I don't know the math on that, does that make a difference?
In theory it would. If you were doing that test daily, for instance, if it missed you on Monday, hopefully it would get you on Tuesday type thing. I mean, probably. But again, this is where, and you remember me weeks ago, talking and calling on the president to use the Defense Procurement Act to rapidly ramp up the research and the production on these very issues, that ideally we would have a rapid test that was inexpensive, that people could do at home on a daily basis. And that would make all of this so much safer. Is it safe to go to work? Is it safe for your child to go to school? So unfortunately, we just don't have that yet. I hear and read about many companies that are working very quickly to try to get to that place where they have a rapid test that would give you an answer in 15, 20 minutes that is sensitive enough that we could use it as a screening test and is inexpensive enough that we could ask people, or the federal funding could provide for people to have tests that they could do at least several times a week to see whether or not they were positive. That would be ideal, but we are not anywhere close to that, unfortunately, yet.
And you guys showed one at one of the press conferences back when we were still in person. Is that in use, or is it just not because of the sensitivity? Or just not in use?
It's not in use for two reasons. One, it turned out that particular machine ended up being one of the less sensitive tests. And two, we have not been able to get any cartridges for it because they're just not making enough. And so, if we had that machine, we would be using it selectively, and knowing that we could get a confirmatory PCR test if we needed to, if we had a concern about the results. But we can't get cartridges either.
And question about schools. We heard last night a bunch of districts laid out preliminary plans or recommended plans. And one of the common themes was that they had to go back to the drawing board after the governor and the PTE updated their guidance last week. And part of that guidance is the 6-foot spacing. And I'm a little confused about it. I'm curious, in your conversation with superintendents, what that guidance is. It mandatory 6 feet spacing? Is it when possible? Can you clear that up?
Yeah, the governor and Secretary of Health's guidance said 6 feet where there was some qualifier, and I can't remember exactly what the word they used was. It is not mandatory 6 feet. And our guidance here in Montgomery County that we've developed in a collaborative process with our 22 school superintendents is 6 feet where feasible. And then we offer suggestions when 6 feet is not feasible. And that includes wearing a mask and a face shield, purchasing sneeze guards, which are those sort of little partitions that can go around in between students. So they do have some options to work with, because there are some classrooms in some buildings in our school districts where that is they cannot get students 6 feet apart.
And so just to clarify that, they don't need to be 6 feet apart. So I heard some districts saying that there's no way that they could space out. So they're going to have to, they couldn't offer the quote unquote traditional, they would have to do 2 days a week. Is that based on what the governor is saying, or is that kind of their own? And I know I'm asking you to climb into their heads and answer a question that might be unanswerable, but that's not necessarily a strict must be 6 feet.
Anyone can read the governor and secretary's order for themselves. I'm sorry, I don't remember exactly how they phrased it, but there was a qualifier that implied where feasible. And that has been the guidance that the county has put out as well. Because again, across our school districts, there are classrooms where 6 feet is not possible. And I think that, again, as a practical matter, there are many competing issues here, particularly for grade school children. They cannot be left at home alone, and they also are the least successful distance learners, unless they really have kind of a full-time parent there assisting. And so we also know now that children, from a pretty good study out of South Korea, that children that are under 10 seem to have a very low risk of spreading the virus. So, fortunately, the group that probably needs in-person instruction the most also is relatively low risk when it comes to spreading this virus. So, sort of that's one cohort. And it does get a little bit easier for distance learning as the students get older. They're more successful at it. And in some cases, it may be a little safer to leave them home unsupervised if a parent has to go to work. But again, this is where I go back to each family is going to have to really look at their personal circumstances and work with their school district, see what's being offered, and make a decision for their family. I think the schools have been 100% clear that they cannot guarantee that there will not be coronavirus in their school at some point during the year. It's just not possible. You know how contagious this virus is. So it is going to be a fluid situation. We are all going to have to work together. We are committed to working as closely as possible with our schools and providing them as much support and guidance as we can. And also doing the contact tracing. That question has come up, I know, a couple times in the last few days, that the county will be doing the contact tracing for the schools. We already have 25 full-time people working on that, and our partner organizations are hiring another 20. And if we need to hire more than that, we will. We're committed to providing that support to our schools.
I'm good, thanks.
Thanks, Jim. Now we'll go to Teresa Harris, who has some questions from reporters who couldn't be with us here today.
I have a few questions from Deanna Durante of NBC 10. The first one is there any concern now about kids returning to school combined with the length of time for test results? While the districts say that they would notify folks, they also said a point of concern is the length of time that it takes to get the results, 7 days or more. And that 7+ days are days that they could have been isolating.
Right. Yeah, Teresa, I think I went into that in great detail with Mr. Melwert, so I don't think there's a need for me to repeat that again.
And the other questions were about notification. If a child or student or staff or test positive, how they'll be notified.
Yeah, let me actually just expand on that a little bit. So the way this works is that our contact tracers, every morning, one of our staff from the Office of Public Health goes to a central database that is run by the Pennsylvania Department of Health. And every lab that is doing COVID-19 testing in Pennsylvania or on Pennsylvania residents is required to report their test results to this central laboratory. Most of the time, they report results kind of simultaneously to the PADOH database and to individuals. But what that means is that depending on the time of day and things like that, an individual might learn that they're positive and before, directly from, say, Quest or LabCorp, before our contact tracers have actually pulled those results down. So there's usually no more than like a 12-hour lag in there. But so what that means as a practical matter is sometimes the school might know before our contact tracers have actually gotten that result and started to do their work. And so good communication between the entities is always the best, always gives us the best outcome. And the schools know how to contact us. And they would, if they wish, they can let us know that they got notice of a positive case in their school, and we would start to work with them immediately on how to manage that. But if for some reason, a family knew and didn't tell the school, our contact tracers would usually know at the most within a day of that positive case. So again, this is just a very collaborative process. We're working together with the goal of keeping our schools and our whole community as safe as possible.
Her next question was that since the state guidance was released, many schools have changed, from in-person to learning virtual. If they can't space children 6 feet apart, is there any concern about the lack of in-person instruction for children?
Well, as I said, the state guidance does provide for some flexibility in that language. So, and people can read that for themselves. Mm-hmm. And I think I addressed the in-person piece earlier as well, that I'm not an educator, I'm not a teacher, so this is not my area of expertise. But what I hear from our educators is that it's most challenging for grade school children to learn remotely. And it gets less challenging the older they get. And so, again, I think that at least here in Montgomery County, many of our schools are working very hard to get the younger children back into the classroom, if at all possible. And obviously, there are many students that have unique learning needs where they really do need in-person instruction, and they're working very hard to make sure that those students get served as well. So our school districts are doing a really good job on this. They have been working on this for weeks. I know that because I meet with the superintendents every week. And I just want every parent out there to know how hard every school district is working on this, how seriously they are taking this. And they are really, as I said before, heroes in this. They are trying to do their absolute best with the resources they have in terms of their building layouts and the classrooms, that they have. They're working to incorporate outdoor space into the day. They are working to use their gyms and auditoriums and, other like theater-like spaces for classes. They're really doing everything they can to make the learning environment as robust and able to serve all of the students in Montgomery County as they can.
Okay, I think the last question is, do you have any idea how flu clinics will be able to operate during the COVID-19 pandemic, since they typically draw large crowds? And how will you be working to secure the flu vaccine and safely distribute it to adults and children under those conditions?
Mm-hmm. Well, we've had a lot of experience with bringing people to locations in our primary election on June the 2nd, when we had 88,688 people vote. So we understand how to socially distance individuals and set up lines and lots of signage and guidance. Absolutely, we would require masks for anybody who was coming to one of our flu vaccine clinics. So we will make it as safe as we can, and we will have guidance that will make it safe, and we will ask people to follow that guidance if they choose to get a flu vaccine with the county. Obviously, they can go to other places. They can go to drugstores. They can go to their healthcare provider's office. There are many places where people can go to get flu vaccines. And so if they don't want to comply with our guidance, which will definitely require wearing a mask, there will be other places where they can go and maybe they can not have to meet some of those requirements.
There's no more questions.
Okay. All right. Well, thank you, everyone. Stay safe out there. And remember, don't leave your home without your mask. And we will see you next Wednesday at 3 o'clock. Thank you, Sarah. Have a good day.